We've been talking about all these recalls, right? E. coli on lettuce, blueberries, sprouts. You may find yourself wondering, is it safe to eat produce these days? And you may be asking, what's with all the outbreaks?
Our consumer investigator, Christine Lazar, is here with some insight. Everybody's talking about this. It does feel like there's a constant recall to be discussing.
Well, it was a question I had. And I was also like, why is California not part of this? Are we somehow safer here?
Right.
I had a friend visiting from Texas, and she saw me eating a salad and was like, what are you doing?
Right.
And I was like, I'm still eating salads.
Yeah, me too.
Am I wrong? So we set out to get some answers.
Okay.
So more than 6.5 million households simply stopped buying lettuce last month. That's according to a data analysis firm, Numerator. Recent foodborne illnesses and outbreaks are causing people to change their diets and their grocery lists. But why are these outbreaks happening? And should we be concerned that this is our new normal? For more on that, we turn to Yale epidemiologist, Dr. Katelyn Jetelina. Katelyn, thanks so much for joining us this morning.
Thanks for having me.
So the big question everybody has is, why are we experiencing so many fresh produce recalls due to these foodborne illnesses right now?
Yeah, so first of all, foodborne illnesses is a big public health problem every year. I just want to be clear on that. Usually we see about 1 in 6 Americans, which is about, 5 to 6 million Californians get sick annually. Most think it's just a stomach bug and write it out at home. But it sure feels different, like you're saying, and I think it is. While the number of food recalls is not abnormal this year, what we are seeing is that when an outbreak hits, it is bigger. This year's Cyclospora outbreak, which happened with those leafy greens on a national level, is running about 4 times higher than the annual case count we typically see. By weight, pounds of food recalled at USDA hit a 10-year high in just the first half of this year. And why is this happening? Well, when the systems are meant to catch this stuff erode at a federal level, more people are gonna get sick, right? Our federal public health system has been decimated over the past 18 months. Thousands of jobs cut at FDA and CDC. Disease surveillance is scaled way back. And I know scientists are doing the best that they can do, but with less funding, less staff, and less leadership at the federal level, outbreaks are going to be taking longer to catch.
Yeah, I listened to one podcast you did, and you said basically scientists say these bacteria, that they have ears, that they know when we're kind of not on guard.
That's right. That's why I say bugs have ears, and they do. I mean, the whole point of bugs is to find all of the cracks and vulnerabilities in our systems. And the bigger those gaps and cracks are, the more they're going to infiltrate it. We're seeing this with measles all the way to foodborne outbreaks.
So here in California, we have not been part of this Cyclospora outbreak. We haven't had as many cases as other states. Why is that? Why here in California are we kind of not experiencing the same thing that the rest of the nation is?
Yeah, so distribution networks of food are actually incredibly complex and broad, but with Cyclospora, California got pretty lucky, right? It was recalled lettuce. It was imported from central Mexico, not grown in California, and it was distributed mainly through food service locations and retailers to a specific number of states, mainly in the Midwest, South and East Coast. So California wasn't touched. In fact, what we saw in California this year is the number of cases right now are actually fewer than the same time period in 2025.
So additionally, does California do a better job than other states when it comes to keeping our produce safe? Or is it that we grow more here locally than other states? Does that also help us?
Yeah, it's a really good question. I think it's all of the above. But overall, when the federal government steps back, states need to step up. And California has been a leader in stepping up to fill public health gaps made by the federal government right now. There's no doubt about that. Also, California has this really long-standing audited government-backed food safety program, and also one specifically built around leafy greens, which wasn't implicated this outbreak, right? So I do feel that California does have our backs as consumers, but things are gonna fall between the cracks here and there.
Okay, and we have to go, but just really quickly, if you were living in California, if you're someone here, is it safe to eat lettuce?
Yes, please eat produce. This is really important. It is safe to eat lettuce in the state of California. Wash produce thoroughly, scrub it. It is a really important part of our diet. And then watch for symptoms. And if you have diarrhea, cramping, fever, and you're high risk, like you're pregnant or immunocompromised, don't sit it out at home. Call your physician because they may be able to help you.
Doctor, thanks so much for joining us this morning. You really gave us some good perspective there, and we appreciate it.
Thanks for having me.
Sheba and Jamie, back to you.